पॉलिसी बाजार पर 1 करोड़ रुपए का टर्म लाइफ इंश्योरेंस केवल 450 रुपए महीने से शुरू। वाव!
Now, lead focus remains on COVID. While the government has said there's no need to panic, Divya, but of course, there are steps that need to be taken because, of course, precaution is better than cure. So before that China's surge spreads to other countries, the Indian government has already taken precautions and advising the same. Union Health Minister Mansukh Mandavia will hold a meeting with the states on the issue of COVID-19 at 3 p.m. Now, this meeting will be held with the health ministers of multiple states.
That's right. Priyanshi, meeting will be held through video conferencing regarding the situation as far as coronavirus is concerned, the preparations and its challenges. Though the government has said there's no need to panic, everything is under control. However, like Priyanshi was mentioning, a lot of protocols will now be back in place, including the mask. The government is suggesting it hasn't been mandated so far pan-India, but some states are also now referring to certain states saying that they should now start wearing the mask, especially in indoor spaces and crowded spaces. We have Vedant joining us on the phone line. Vedant, given that the holiday season is on, many people will be traveling within the country, also many visitors expected to come inside the country, many expected to even be going out of India as far as the Christmas holiday season is concerned. Take us through some of the protocols that might be back in place.
That's right, Divya. In fact, yesterday, Prime Minister said that masking up and social distancing are the only solutions to the problem, and that should be central as far as India's COVID response is concerned. In fact, the Health Ministry has also written to the international airports saying that 2% random sampling will be conducted from tomorrow itself. That is something that the Prime Minister also said in the review meeting that he chaired yesterday. In fact, he emphasized on strengthening surveillance at international airports and also told states to audit COVID-specific facilities, oxygen plants, ventilators to make sure that the COVID infrastructure is there in place, and in fact dedicated COVID care centers are also back. He also advised the states to share larger number of samples for genome sequencing, as genome sequencing and surveillance are really at the heart of India's COVID response at this point in time. And he also assured the country that there's adequate availability of hospital beds, medicines and vaccines. So that is something that should not be a cause for concern. Now, today, as you rightly mentioned, Union Health Minister Mansukh Mandavia will be chairing this review meet with health ministers of states and union territories. This will be at around 3 p.m. Via video conferencing, as you were saying. And what is likely on the agenda? So we are being told by sources in the health ministry that two important things. One is, of course, the COVID preparedness. So an advisory to states is likely after this meet. That is what we are being told. As far as the mask mandate is concerned, remember yesterday all the chief ministers of states had said that they will be following whatever the government's mandate will be. As of now, there is no mask mandate in place, and there's no blanket fine as far as not wearing masks is concerned. So that might be back, but the focus will really be on COVID infrastructure, ensuring that there are COVID care centers, human resources, and vaccines, hospital beds. All of them are in place. That is what the Prime Minister also said.
Right. Thanks very much, Vedant, for joining us with those details. And as Vedant was mentioning that masks have not been made mandatory yet, but of course, as that holiday season is coming up, people are going on trips, on parties. So it's definitely advised that you follow COVID protocol during that, so your trips are not hampered because of that. And in some states, such as Karnataka, that have made masking mandatory, at least in indoor spaces, but it's not a pan-India advisory as of now. Now, where did this concern really came up for India? The cause for panic does not exist yet, but there's been a concern after 4 cases of the virus variant that's driving the surge in China. That very variant has been detected in India as well. With that, there's a focus on genome sequences to identify these new variants in India before they spread across the masses.
That's right, Priyanshi, and the Prime Minister, after a review meeting yesterday on the COVID situation, has advised to use masks and increased testing as far as COVID is concerned. There's been concern after those 4 cases of the virus variant playing havoc in China that was detected in India as well. The centre has told the states to focus on awareness. So, just spreading awareness and, of course, leaving it to people for now in order to keep themselves safe.
Right. As cases in India currently are just around 120, 150. That's the daily average, which is the lowest since the start of the pandemic. But states are stepping up their efforts to combat COVID. In Delhi, the Chief Minister says that no new variant cases have been detected in the national capital. In Bengal, they are stepping up genome sequences, and Karnataka, as we said, has made masks mandatory indoors.